Hello everyone. We're probably not going to be able to follow that fantastic drama production, so stick with us. We have got a slightly amusing video at the end of the presentation. I'm Hannah Barker. I work for the community team for people with learning disabilities. We're a health team that works with people with learning disabilities across Northamptonshire.
I'm Emma Barros. I'm a learning disability nurse.
Okay, so we're going to tell you briefly this afternoon about healthcare when young people are preparing to leave school or after they've left school. This is aimed at all of you, young people, parents and professionals, hopefully to help you learn a bit more about what you're entitled for and what you can ask for with regards to your healthcare and well-being. So I think what we'd like to acknowledge is that it's not always easy understanding information about healthcare. These are just a few examples of some of the leaflets that are in production currently. And as we move into adulthood, there's lots and lots of messages about keeping healthy, and they're often aimed at people who are quite good at reading or find it easy to understand lots of complex and new information. There are some really, really good social media formats that are more interactive and that can make it easier to understand things, but they're not always reliable. So we'd just like to remind you of that, really, because it means what we learn might not always be correct, because anybody can put anything on the internet.
Okay, so how do we know when we're poorly? How do we know when something's wrong? We actually only know what we know. If I haven't been for a poo for 5 days, I know that that means I'm constipated. But if you don't know that going for a poo every few days is right, who are you going to tell about it? How do you know if actually when you stand up and you feel dizzy that isn't usual? Or when you've got butterflies in your tummy all of the time and you're sweating a lot, that's not usual? Kind of as you move from school into adulthood, you're not necessarily going to have the same people around you who know you really well. Like we saw in your production, the teacher noticing that the young person really wasn't themselves and that was something that was wrong. You're going to be reliant on other people other than your school and your school nurses to interpret kind of how you're feeling, or you've got to be able to tell somebody else. Which brings me on to knowing who to tell. So for maybe some parents or carers, obviously children or young people move from our paediatric services where we've got paediatricians who we've known for a long time who've got to know our young people really well, moving into mainstream services, so turning up to see the GP who actually doesn't really understand our young person, has not really had any input with them because they've always been cared for by the paediatrician. So actually, one of the challenges is knowing who to tell and getting them to do something. We know, evidence tells us, and we know from our kind of professional work, that actually in mainstream services, they don't always know how to ask the right questions. And if they don't ask the right questions, they don't get the right answers. And then it's much more difficult for them to give the right advice and to make the right diagnosis.
It's about getting the right thing at the right time. So sometimes when you go to the GP, and that's either if you go on your own or you go with your parent or somebody else who supports you or works with you or looks after you, the GP might use really big words, new words, things that are difficult to understand. And it might not be a GP, it might be another doctor at the hospital or the nurse at the surgery or any health professional that you come into contact with. So we've got some information to tell you about how you can make that more easy for either yourself or the person that you're supporting. One of the things that happens very regularly is that health professionals use really big words, and sometimes we understand them and sometimes we don't. And I would say, myself included, if I go to my own health professional appointments. So they might use big words, really long sentences that are hard to understand, or ask really hard questions that you might not know the answer to. and sometimes you have to make a decision that's really important. What we'd like to really say today is that it's absolutely fine to ask for extra time to make a decision, even if it means coming back another day, and to say really clearly to you that it's not okay for the doctor to do nothing. You need to ask for extra support, extra time and adjustments to be made. Okay. So a bit about talking to the doctor. And we're probably talking mainly about GPs here, but I think this could also relate to other doctors as well that you might come across. So moving into adulthood, as Emma said, means you go more to the GP than to your paediatrician, who you might have seen for a long time. And staff at the GP practice need to get to know either you or the young person you're working with in preparation for the handover from Children's Service. The Equality Act 2010 says that health professionals by law have to make reasonable adjustments for people who have additional needs, and that means adapting a different practice or a different procedure to accommodate a person's disability. And this can include things like double appointment times to allow time to discuss difficult issues, offering appointments at the times of day that would be less disruptive for a person, for example, if they get very anxious, sensitive to noise, waiting in a busy waiting room, and so on. You can ask for all of those things to be taken into account and for some different measures to be put into place. And you can ask for reasonable adjustments to make sure that the person is comfortable and happy and able to sit and wait for their appointment or to be seen early or more quickly. It's about achieving the same outcomes as for people who don't have additional needs. Yes.
I'm going to move this down because I feel like I'm standing on tiptoe. Okay, so one way that's been brought in by the big bosses in the NHS, called NHS England. So they've introduced what they call an enhanced service. So that means they pay our GP surgeries to provide people 14 years and over who have got a learning disability with what they call an annual health check. And kind of thinking about the things we've said and in the production, this is a key opportunity to get to know your GP or your practice nurse and the practice staff, because when you need to go and ask to speak to somebody about going on the pill, actually you're going to start to feel a bit more comfortable with them. So this is a great opportunity. Okay, so what can you talk about? How to stay well. Right, I've got some pictures. So, things that will be talked about. So there will be lots of things about your physical health. You'll probably be offered the opportunity to have your blood taken. Again, that might come with lots of challenges, but that's okay because we've been talking about reasonable adjustments. So actually you might not have your blood taken at that appointment. You might be offered a separate appointment. You might need to go for 3 or 4 appointments till you get ready and used to being able to have a blood test, and that's okay. They'll be looking at your weight, thinking about, is that a healthy weight? Thinking about, are you doing exercise to stay healthy? Talking about poo and wee, talking about men's health, girls' health, periods, contraception, smoking, staying healthy, alcohol, what you eat, your emotions. This is a good opportunity if you've got quite a skilled GP to be able to talk about kind of feelings and mental health, spots, feet, dirty, horrible toenails. We do try and encourage the GPs and the practice nurses to have a look at feet, because actually sometimes when young people are living on their own, parents are not cutting their toenails anymore, they become quite grim. Pain, expressing pain, actually it is really important that you're able to tell somebody if you're in pain, and for the GP and the practice nurse to be able to prescribe you something if necessary. Brain, I don't know why I put that in. Maybe if you have epilepsy or any other neurological type conditions, that's a great opportunity for them to talk about those with you. Drugs. And also helping you think about, actually, are you going to see the optician? Are you having your eyes checked? prompts about dentist and oral health. And you know what? Anything else that you want to talk about. These appointments should be longer than a standard appointment, which I think is around about 7 minutes for a normal appointment. So actually these appointments should be around half an hour. You should be able to see both the GP and the nurse, although lots of our nurses now are advanced nurse practitioners, so sometimes they will do the whole thing.
At the Learning Disability Annual Health Check, you should receive a health action plan. It might not necessarily look like this. This is just an example of one. Some GP surgeries will have their own bespoke one that they've made themselves. Others will have a standard one like this, and some might just give you a list on paper of things that you need to do to keep healthy. But the idea is for whoever's going to the GP for their Learning Disability Annual Health Check, they will take away some information and advice that's written down rather than just having to remember it, because that's always the hard part. Whoops. Right.
Okay, so did you know? You can ask for information in a way that you understand it. There's a new standard that's come out, and that covers for all health and social care services. It's called the Accessible Information Standard, which means that by law, we all have to be able to provide information in an accessible way. So that means for some people it might be easy read, some people that might be big writing, sometimes that might be by text. So actually that's something that's really coming on board that people, those services are starting to try and get on top of. You can ask for extra time at your appointment, and actually you could ask for a visit to go and look round. Kind of touches on what the performance people were talking about earlier. As we get older as women, we end up having to go to have smear tests, and that's something that should be talked about at your annual health check. That's something that's really quite a big step, and actually talking with your practice nurse, getting to go and have like a visit to the practice nurse, the room, looking at the equipment, they're all things that the GPs and the practice nurses can do, and that will hopefully mean that the uptake of cervical screening is improved, which obviously improves our life chances. There's something else, and I don't know if people are aware of it, but it's called a single clinical record. And it's something that's held by your GP, everybody has one of these. And it's basically information that is shared with other services in an emergency. So all the GP surgeries have these big electronic systems, but they don't all talk to each other. So if I needed an ambulance, they wouldn't necessarily have all of my information on me. They'd just see some key details. So if you've got additional needs, you can ask your GP to add extra information, so additional information to that single clinical record. So let's say I have autism. Actually, I might want the ambulance service or another service to know that when they come and pick me up, because actually I might want things done in a different way, but they won't necessarily have that information unless we tell them to do that. So I've got some information with me, and it's kind of a letter that you can take to your GP to say, actually, I give you consent to share my single clinical record, and these are the additional bits of information that I want included. Oh, me again. Did you know? Just another little fact. For some of our young people, having a flu vaccination injection is sometimes quite daunting. Did you know that actually, even though once you reach the age that you wouldn't usually be able to have the nasal spray, actually you can. This is a reasonable adjustment. What they've said is, although it's not quite as effective, it is still effective enough to give cover. So again, it's not okay for the GP to do nothing. This is a reasonable adjustment.
Let me tell you a story about a lady called Dee. Turned a funny yellow colour, so went to A&E. Doctors were puzzled, so the tests all began, till Dee remembered that she'd had a fake tan. Silly Dee. But that's not the end of Dee's A&E tale. Back the next week, couldn't get off a fake nail. Then a friend was poorly, feeling a bit groggy, but A&E's really no place for a moggy. Poor little pussycat. And let's not mention when Dee had thrush. That's not an emergency, that's not a mad rush. Bear this in mind, and I'm sure you'll agree, it's not the place for her. This is accident emergency.
Remember this and sing with me. Don't just rush to A&E. Choose walk-in pharmacy or GP if yours is not an emergency.
If you got a sniffle or a headache or a sneeze, the place to be heading is the pharmacy. So listen to me, my advice for the nation: visit pharmacies for diarrhea and constipation. If you sprain your ankle, you can hop to a walk-in. They're the place for minor injury sporting. They treat animal bites, stings and minor burns, suspected broken bones and all your skin concerns. And when to use your GP, you say, for illness and injury that won't go away.
Remember this and sing with me. Don't just rush to A&E. Choose walk-in pharmacy or GP if yours is not an emergency.
If you're in need of urgent attention, like a life-threatening situation, suspect a stroke or having a heart attack, then come to us. We welcome you back. Do you have abdominal or chest pains, unconsciousness, or you've cut into a vein, severe burns, head injuries or breathing issues? More for A&E than just needing a tissue.
Remember this and sing with me. Don't just rush to A&E. Choose walk-in pharmacy or GP if yours is not an emergency. Remember this and sing with me. Don't just rush to A&E. Choose walk-in pharmacy or GP if yours is not an emergency.
And one more thing, if you have a poorly pet, a better bet will be take it to the vet.